So such a powerful drug, and that has without doubt changed the landscape of managing CLL, particularly in the relapsed refractory setting where prior to ibrutinib and idelalisib our patients really had so few options, and early death rates in that setting were very poor. So Ibrutinib has transformed this, this domain, and I've been lucky enough to present 2 posters of UK data from the UK CLL Forum cohort of patients. So just for your viewers to remind you, there are 315 patient data set from 62 different hospitals spread across the UK. Brilliant collaborative effort, and I'm so grateful for my colleagues that have allowed us to assemble this data. And we've been tracking this over time, so we've now got a median just short of 30-month follow-up, so we can get a better feel for discontinuation rates, any other new surprises coming along. But you know, looking pretty good. It looks as if its discontinuation rates do decrease over time, which is what people have been showing. We've got data suggesting that patients are more likely to come off, relatively speaking, with progressive CLL in beyond year 1, which fits with other data sets, which is also interesting. And we've also been able to track the patients who've had dose reductions in that first year compared with those who had treatment breaks in the first year. And that's really interesting because particularly the dose reductions, we've just not been able to find any detriment in either discontinuation-free survival or overall survival. So that's quite an important thing. I know it's retrospective, but it's multi-center, it's big data sets, and we've tracked this with a landmark analysis beyond 12 months of patients. So that is one part of that presentation I think is quite useful for routine practice. And we had a second presentation which was looking, well, what happens to these patients when they come off ibrutinib? And we know that you can come off ibrutinib in different states. You can come off because of adverse events, i.e. not related to disease progression at all. And those adverse events can be split into infections and then non-infectious adverse events. And it's quite interesting tracking the survivals of people who come off ibrutinib in the first year for the different reasons. And clearly, coming off for adverse event but not infection, a lot of these patients have gone on to do reasonably well. The patients that have done worse are those coming off with serious infections or those with the Richter's transformation early on. And those patients we really have had poor survivals. But the really, really interesting thing is looking at those who stopped because of progressive CLL. And it's clear, in the first year, we don't have a single survivor in our UK data set of patients who stopped because they came off ibrutinib with progressing disease. However, beyond a year, we've got quite a chunk of patients who are alive and doing well. And the big question is why? Well, you could hypothesize that relapsing beyond 1 year, you're biologically different. Perhaps your disease is a bit more benign. But of course, the big thing we are aware of is access to Venetoclax. And we've been able to get access through compassionate schemes and then the early access to medicine scheme that was run through NHS England. So we've been able to get hold of that drug for those patients who are relapsing beyond 1 year, and we've got a true statistically valid survival benefit for those later relapses. So this is very important because it's going through NICE at the moment. As we speak, it's been discussed after the 3rd review, and we're just really hoping we can get access to that very important drug for our patients in the UK.